The case of an ERCP today, the second one is a 50 years old man. He get laparoscopic cholecystectomy 2 years ago, and now he was referred for CBD stone. We will see on the MRCP done last week. So we see clearly the lower CBD here, and this is the defect we see on the MRCP. We have the left hepatic duct. We will just measure the diameter. So almost 9 millimeter. And we have lower CBD, which is like 6 millimeter. So we will see the other picture. We see clearly here. This is our upper hepatic duct. The middle one is here, and this is the defect we see. So it measures almost 2 centimeter in length and diameter of maybe 8, 9. So the purpose today is to access this region and try to extract this stone. Maybe it's one stone, multiple stone. If we will fail, we will just put plastic stent. So this is the length of the total CBD, 7 centimeters. So we maybe use 10 centimeters, 10 French stent. So let's proceed to our ERCP now. كشكوش يقول هكا عطيكم غسلو هاك في الكانال هذيك الاكسسوار جويد باش ما نبقاش الصابون هكا. So the introduction of our scope. This is our T-tube. So as usual, we push and turn a little bit to the right and continue pushing until we feel the uneasy passing through the upper esophagus sphincter. This is the esophagus mucosa, and we are at 40 centimeters. This is our stomach. This is our antrum. We continue pushing until seeing our pylorus, which is a 6 o'clock position. I will put some CO2 now, and usually we are inside the first duodenum, not yet, so I will continue pushing. This is the first part of the duodenum, and this is the second part. So I will put the little wheel totally at the left and pull back slowly, and this is my papilla here. I see the entrance below. So I have to get myself to the Schwarzkopf position. I see the entrance here just in the lower part of the papilla. I don't know if I will be able to access directly. Maybe doing needle knife pre-cut will be better. So we have to inspect our papilla. We have enough place to do our cut. So we'll try with our sphincter turn before. I will give my 5 minutes. جربتها شايف ولا شايف جربتها ارجع جربتها شايف ارجع. So it's not the papilla here. I don't know what it is, but maybe a lipoma here. I see my papilla just behind this floor. This is our papilla. So we'll go to try to enter here. So I think there is a little fistula here. So we enter directly. We are in the CBD now. So first step done. We see some pew coming. So I will go to the upper part of my CBD. We will switch to the fluoroscopic view. عمل purge, injector. So I will inject some contrast. We see the left hepatic duct dilated. We see this defect here, but what makes me happy now is that I see little stones coming. So I don't think it's a big stone there, but only little stones, injector. And just look at the endoscopic view, what is coming. Inject, injector. Stop. So we see this defect there, but all the stones are coming out. So next step will be the sphincterotomy, but I don't think I will do it because I don't have a lot of space here. Ouais, so I don't want to see bleeding here, neither perforation. So what I will do now, I just exchange my sphincterotomy with an extraction balloon, try to move the defect there, the stone we've seen, and maybe then if I will found bigger stone, I will do just the balloon dilation of the lower CBD and maybe the middle CBD to facilitate extraction. تعمل لي روتاسيون شوية بتاع سكوبي. So we rotate a little bit our fluoroscopy tower and try to get direct vision of the left and right. زيد شوية. سي بون، اطلع لفوق شوية توا، ولا طلع الطاولة، طلعوا الطاولة شوية ترى. طيب سيب. ماشي. So we see clearly the left dilated, the right dilated one. Our guide wire is in left hepatic duct. حل كما نشوفش يبس، حلو بالكدا شنو، حل بالكدا حل. زيد حل زيد. هاك البالون اللي عامل انجكسيون من فوق من اللوط، عرفتو كيف هذاك، وين هذاك؟ برا قلها تمدو حطها. جبده خرجوا على برا تنقول لك تسحقوا له ولا. So this is the balloon going inside. في الجيد نتاعك ما عادش تغزل ليكرون، غادي انا قاعد يزلق لك راهو. سكوبي يجيني لهنا شويه ترى. So زيد شويه زيد. سي بون. So I will push until I reach the middle part. I انفخ 9. So we inflate to 9 millimeter now, and I will pull slowly back my balloon. It doesn't want to move, but something is moving now slowly. And I have to check on the endoscopic view what is coming. I crossed the structure. I see what is coming here. The balloon is just in the papilla now, and a stone is coming. So this is the first stone come out. So we are lucky. This is the stone of 2 centimeter, and the other one is coming behind. So I do little movement without lot of pressure on my balloon, and everything is going out. And the balloon is out. So we will go again and try to clean more. I think we are almost done. And we see all the liquid coming now. So we'll clean again. And still stone coming. So we will enter again as needed as possible, but I have to really clean everything, and then maybe we will do our occlusion cholangiogram to check this upper part of the CBD, but still stone coming. We see the balloon coming also. Après. So the balloon is out, nothing come. So we will put some contrast now to check our CBD and intrahepatic duct. purge. Zit. C'est bon. So I will go to the upper part of the left hepatic duct. هذه لي إيجاد هنا شوية ترى. C'est bon. انفخها. Injectها. So we begin contrast on the left hepatic duct. بمشي بشوية. So we see it clear there, the balloon. The left hepatic duct is all black clear. And this is the level of our stones on the MRCP. I see the right hepatic duct there. I don't see any stone. And this is, I think our structure is regular structure. Injecte. Injecte, injecte, injecte. So I want to check the lower part of my CBD, which I think it's really normal. So I will just move a little bit my scope. نخبي البالون. So I think we lose our balloon. So we see all the contrast coming now. So I will go again in the left hepatic duct, clean everything. امشي 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 خبي في ايد خبي خبي امشي 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 ارجع امشي 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 خبي خبي امشي امشي مش مشكلة انفخ هاي انفخ كله انفخ هاي فش هاي انفخ إذا انفخ اللي قلت لك اقعد هيك كيف نشوف هاي اعطينا بالون يا اخي اعطينا this really does. So we lose our balloon, so we will use قلت لك 100 مرة خرج لبرا ما تغيرك. So we'll check again with another balloon now our CBD. I think I will leave a stand there. So I think we will just check the structure on the middle part of the CBD. And if we look at the fluoroscopic view, the structure is just near the clips, the metallic one. So I think maybe it's a thermal injury of the middle CBD. We extracted all the stone, so that's why we will just check again and maybe put one or two plastic stands there. purge, purge. زيد زيد زيد. اجبد في اليد نتاعك، اجبد 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 اجبد. امشي 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 امشي. اجبد في اليد، خليه يمشي. اجبد امشي. So I want my wire to go there. So this is my good direction. اجبد في اليد، اجبد. اجبد اجبد، خرج. امشي امشي امشي. ارجع امشي. So I have a loop of my wire there. بربي سكوبي ما تنسوهاش امانك اللي قالت لي نص فيها تو. انفخ هاي. نافع. injected. So we'll check again the upper left hepatic duct. I just inflated the balloon to 9 millimeter. Stopped. So this is a common hepatic duct, and we see how it's regular structure. This is an inflammatory structure. We cleared all our CBD, but still have this structure there. Stop. So I will leave my wire there. I still get some stone coming. I will go again. خبي في الجيت خبي ترى. نمشي على اليسار. Donc I want to get access to the right hepatic duct. نمشي ترى. انفخ لي ترى. انفخ كله. I will inflate to 12 millimeter and see if I can cross. It's really hard to cross here. And I still see something coming. Stones. خبي في الجيت خبي. خبي في الجيت. خبي خبي خبي. في الجيت بتاعك ازاي. امشي 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 امشي. And this is a 12 millimeter balloon going out easily. جبت في ايدي جبت. خبيه كان ما تنجمش خبيه راهو. ديرك قبل قداش توا بنشف في يديك شويه طب كلك تزلبط هكاك باش تعدي ما تنجمش تحرك وراك. بنشف في يديك انا خذ كومبريس راك. سكوبيه. خبي في ايدي. امشي ترى. امشي برا. انفخ ليها. So still having little stones coming. So we will clean again, but I think I will stop cleaning. I will use a dilation balloon and try to dilate this structure. I'm sure we have stones in the left hepatic duct. نفخت اخي معليش. نظمت ما قلتلكش انفخ. So I try to enter the distal part of my left hepatic duct like this. I comfortable. 9 inject. Yeah. I will put some contrast. اطلع لي سكوبي سنتي لفوق. برا. So I see the left hepatic duct clearly now. ايش بتخبي في بتاعك خبي ترى. خبي خبي خبي. امشي ترى امشي. امشي تصيبي امشي هيك. اقعد امشي. I will pull back slowly my balloon. I don't have really big stone, but I think we will dilate now for sure. So our wire is really in the distal part of our left hepatic duct. I'm sure it's a benign structure. It's a regular one. So I will dilate maybe to 8 or 10 and maybe insert 1 or 2 stents. Dilatation 8, 8 of 17. So the next step will be the dilation. So of course we resolved the problem of the stones, but we have not resolved the problem of the source, the cause of this structure. It's a benign one regarding the clips done before. Sure, it's a thermal injury induced by the heat. So I will try to dilate now toward the left hepatic duct, and I will leave one guide wire there, and I use another one to try to access the right hepatic duct and put maybe 2 stents there. With 9-17. So as we have left hepatic duct measuring, I think 8 millimeter, so we'll begin dilation at 8. نحي لي أعطيها لها هي. ايش في الشيء. هاي في الجيدة. So I see the balloon going easily. If there is resistance, it's because of the tension on the wire. So the first mark has crossed the structure. It's in the left hepatic duct. So I will inject some contrast now. يا ناهد يا ناهد، ريت الطاولة علاش نفكسيوها احنا علاش نفيكسيو طاوله؟ باش لي غوبير نتاعك ما بدلوش. كيف تتحرك انت اشاك فوا طاوله معاك تنسى اللي انت قاعده تتحرك راهو. دونك ما عادش تغزر لهنا. دونك فيكسي طاولتك. صح ماهيش خدمتي راهي فيكسي اون تابل ماهيش خدمتي انا راهو. اعطيها صغيره تركب. زيدك بس زيد انت من غادي. يعني اللي عمل لك كولونجي ولا حتى شيء مانك. قاعد نعس عليكم هذاش قاعدين تعملوا. انجكتيا. So we see the structure easily here. في الشيء. ممكن انت سيب وقتك هيك. I will pull back slowly until here. Inject here. And you see easily without any pressure. سكر أعطيها. أطلت خوي. So I will go until 3 to have an 8 millimeter and we don't see any structure now. أطلع لل 4,5 5. This will be this. So I will push the guide wire and pull back slowly my dilation balloon. So I think it's okay here. فاش ليه؟ فاش على زيرو ورا. So as we didn't do any sphincterotomy, I will go. This will give it. I will take my balloon out and do my balloon dilation. So this is the balloon. أطلع لتخواه. So I want to see the little part of my ده. أطلع للسانكة. أطلع للسيتة. سيتو بعد بيتا. Very bien, parfait. So we dilated until 10 millimeter the papilla. So you see. And this is the sphincter there. نبدأ في الشيء. ايش قلت لي ايش بدأ؟ So usually what happens after dilation, we will see some little stone coming. Of course, some blood. This will get the blood is coming. We have to secure our wire there. أنا هتحطها هكذا. امشي 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 امشي. ما عادش تغزر الاكرون تدوس في الفيل ومش قاعد يقدم لك راهو. ما يقدملكش لازم تغزر عندك انت الاكرون ما فيه شيء سكوبي مش تمشي ديجا. نحي نحي انت غادي نحيها شد لها باش تنحي. اعطيني انا في القيد اخرى. نايف هيت نايف اللي اللي عندك حاضر هيت. So I will try now to cannulate the right hepatic duct. So if you are lucky, we found ourselves directly in the right one, but we are in the left one. أرجع. So I will go with my أرجع. امشي 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 امشي. أرجع امشي. امشي امشي امشي. ارجع ارجع. امشي. ارجع. خبي خبي. امشي امشي امشي. So I'm still in the left one. ارجع ارجع. امشي. ارجع. 0.25 كده. امشي امشي بشوية. امشي. ارجع. امشي. اعطيني في الجيد سفنكتيراتور. اعطيني هز لي عليا. اعطيني واحد جديد. هز عليا هز قلت لك. 35 ها. زيد ماء. هنا ما خرجكش ماء. زيد ماء. امشي بشوية. ارجع ارجع ارجع. امشي ترى. امشي. ارجع. امشي. So we are still going in the right left hepatic one. So I'll push maybe more my sphincter term. ارجع ارجع. امشي امشي. ارجع. امشي. ارجع. So I have to make a loop in the lower hepatic duct. امشي. And that can change my direction like this. And we are in the right hepatic one, the posterior one. Stop using T. So now I will go with my sphincter term in the right hepatic duct and try contrast. Inject some contrast and try to put maybe a stent in the posterior one. Inject. So we see our right hepatic duct, like it looks okay, but I will surely dilate here. Ah, this will be this. Stop, c'est bon. امشي امشي. So we have two wire left and right. اعطيني البالون 6 6 7 8. So I will use the 6 millimeter dilation balloon, 6 to 8. خلي نهاية حاجتي بالواحد. حاجتي خلي. أعطيها تهز الإكستريميتي عندها أعطيها. جبد لي 5 سنتي. خذ سرعك فشلي انت. هذيلي كومبريس بربي. في الجيدن هذا يعاودني في الجيدن. So the balloon is going out. So بشوية في الجيد بشوية بشوية. دز في الجيد نتاعك دز. So we didn't cross still the structure. نهي دز في الجيد خاطرني لازمني لكحة بعيد ماشي. نجمتش. اجبد في الجيد اجبد اجبد. اجبد. استنى دقيقة. اجبد في الجيد اجبد. امشي 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 امشي. امشي 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 زيد نمشي برشا راهو. امشي امشي. خلي بوكلي يطلع فوق باش مشي. امشي زيد امشي زيد. So I'm not able to cross the little structure there. So we see that the balloon is like resisting. اجبد شوية ترى. So I'll try to get the same direction of my CBD and push from below like this. It won't be easy to cross. I think we'll change our balloon. We see that the pressure on the balloon and it does not بدل البالون ناحية. دز في الجيد دز خلينا نخرج. دز. دز. نحي لها اللي ما غادي نحششنا بيه هكا. نحي. دز. اعطيني البالون الاخر. اعطيني البالون اللي هنا هذا ال 8 9 10. اعطيها هذاك تهز اعطيها تهز. اعطيها تهز هذاك. أعطيها تفشلك هاي تو. So we see the first marker there. So the balloon is going straight now. Just have to get the same direction. So at this level I have some resistance. So what I will do ايش بدي في الجيت شوي ايش بدي ايش بدي زيد سيب اخذك هيك. I think we are just advancing slowly. ايش في الجيت شوي تو. So I can't cross here. I don't know what's happening. This will be this. نمشي هيك اخذك هيك. So I pushed the wire inside the right hepatic duct. أمانكم حصته هكا بربي هكا هذيلي بربي. So I have a little loop in the distance. شكون اجبد في الجيت شوية زوز سنتي ترى. اجبد اجبد اقعدك هيك. So just it go up a little bit. Maybe with some effort it will go inside. So we see on the fluoroscopic view we are not on the axis of the CBD, so while pushing we are not تعرفت اسكوبي لوطة شوية. So I have to be really like this and push from below. J'arrive pas. T'injectes tes contrastes là في البالون. Injecte. حكاية روتاسيون فشي. طب ربي نحيته هذيك علاش انت. يا لا ما يصيرش. باش نفش بيها بريسيون نيجاتيف يا راه ما تقلقش راهي تعاود تفش راهو. سكر روح سكر. اجبد. So I won't do more. اجبد خدنا نعاود نخرج نحي كل شيء نحيت. دز في دز. اش عندك بالون جديد؟ شنو في واحدة واحدة؟ يا ناهد كيف تو ديسيد باش توقف قول لي راني ستوب راهو باش تفهم روحي انا راهو. اي قاعد نجبد انا قبل ما تعمل حاجه قول لي انا كملت انا مش نجم نخرج انا. شنيا؟ اعطيه بالون اكستراكسيون. عدي 100 عدي 100 عدي. So the extraction balloon will cross easily. I think it's part of an angulation. I hope enough. So we'll inflate to 9 and try to clean this right CBD, right hepatic duct, so it is crossing easily our stricture. I will just wait to see if there is some stone coming. I don't have to lose the other wire. And the balloon is here and nothing come out. I contrast. So we will do our occlusion cholangiogram on the right hepatic duct. So we'll go again inside. So I am in the right one now. So we check the right hepatic duct for stones. So it's normal right hepatic duct. This is a hepatic duct. It's a little bit dilated, but I think it's a normal one here. Maybe the stricture there, I just want to dilate it a little bit. Stop easy. So two choice now. We can put directly a stand there. خلينا ننظف شوية. So I don't have any stone there. So why our dilation balloon don't want to cross? So maybe because the friction with the other guide wire in the left hepatic duct. So this is the point. So this is now, we'll decide this stand we'll put the length. So I'm clearly seeing now the marker of the extraction balloon. So I will put my first marker there. I will pull this. I will pull back my extraction balloon until I see the marker in the duodenum. And this is, so I think a 12 millimeter, 10 millimeter will be enough. But I will try again the dilation balloon, and maybe I will take back a little bit the left wire. Dilatation. معلش 6 8 هكا. No. دز مش تعطيك بصورة ما. اي انا ريت الدور هذو اللي قلق لازم دورة واحدة تبدا هابطة، مش هكا كي برا مشي. اعطيها تشد لك مش اعطيها. باش نخرج. اعطيني اكزيلو ترى، اعطيني اكزيلو هنا. سي بون يجي. هاي فش البالون عندك انت يا. تو من غير روبيني هكا تو هكا تو. فش هاي. ليش في الجيدز نتاعك هاي خلينا نمشي. في عاوني على في جيدني هذا. So I decide to try to push my balloon inside without changing anything, and if I will feel the same resistance, I will move the left wire. So now we see clearly where is our structure, and I think we will be able to cross it now. We crossed it now, c'est bon, regardez. خذ contraste انت. Injecté. So we see the balloon there. So I don't have any real structure there, but I will dilate. هي جينا. أعطيها. أعطى 3. So we'll dilate to 8 millimeter. طيب نقعد هكاك. I think it's okay. فش هاي. اجبد الكل شيء قلت لي. دز في الجيد نتاعك انت. So we will secure our wire there, and now we will put our plastic stand. My left wire is going out, so I have to secure it again. So the two stand, we have to just cross the structure, which is just at the side of the metallic clips. شدي بس عنا 10 عنا 12 ولا 11 15 لي 15 برشا. So we have 15 milli centimeter stand. شنو ياخذ عنا 10 ولا 15 ليه ها اعطيني 10 الاولين اعطيني 10 So my left wire is not well placed. So I will try to just be facing the papilla like this. هيا لسه طيب شنو تو. So we have to really push it inside our CBD and left hepatic duct to just secure. هذاك 10 سنتيمتر امالك ما تمسليش الطاوله هكاك ما تمسش توا هكا كمل حل كمل. So the question now, we will begin by the left or the right. It's the same for me. So I will begin by the left one. Or maybe the right, we are just in the. So we just have to cross the common hepatic duct towards the clips there. So what will be maybe difficult now, we have two 0.35 wire in the channel. So this is maybe will disturb us because it creates some friction. We feel it while pushing our stand. We see friction there. عاوني على الفلقيدة مالك. So the pusher is inside. ما عادش مسلي في الجيد خلي ما عادش تمسليش قاعد تعمل ريت باش تضيع لي بالغوبير نتاعي راهو. So I don't still see my اجب سيستم شو جبت. So we will have some problem because the wire get a lot out. So I don't have any pressure on my تنزل في الجيد نتاعك دز هنا دز خليش دز. ما عادش تتفرج عليك هو شد السيستم قاعد شي قاعد يوخر لي راهو. ريتوش فين ولا السيستم. This is the stand coming. But I'm not facing the papilla, that's why I have some issue with the introduction of my stand. Just have to get the direction. So we see the angulation in the lower part of my stand. This is correct direction. And we see the stand going, but I just need to get more. So this is the middle of the marker. ايش بدك فيك شوي ترى سيب ايش درت زيد اخذك هيك ايش بتسيستم شوي ترى stop stop. So we are at the level of our structure. I think we are crossing the structure now, and this is our second marker. We crossed our structure. ايش بتفلقد شوي ترى ايش بدرت stop. So I will push until I see the distal marker here. ايش بتسيستم ايش شوية stop. So my stand is almost in place. ايش بتفلقد ايش بدرت ايش بدرت اخذك هيك. So I will just leave it like this. ايش بدي ايش بتقول ايش بدرت. So we will now put, so the stand crossed the level of the clips. So we will put هاي stand الأخرى. The other 10 French. حل يجي حل كيف نحلوا ستاند البلاستيك معمول بالعاني اشتراه انت ايش قاعده تحل تو ست خوتاخ تو. عدي ما عدي ما عدي ما عدي. So my wire is secured there. I just will push it. عاد شد انت. So we just need to put the second stand along the first one. We have not a non-tripartite structure, but the common bile duct structure. We dilated until 8 millimeter. That should be enough for crossing the structure. It's always difficult to place two plastic stand one along the other due to friction. between the two stands. So the pusher is coming. So the first step, we have to secure that our pusher in the upper part and cross our structure. I see the marker there. So I will push slowly. And my marker is just behind the scope. Always the same, you have to be in the axis of the CBD, not like this, maybe like this it's better. And we see so the stand is coming. So we have to push in this direction. And if we enter the first part like this, we have just to correct the angulation, push slowly, and our stand is in the good direction. نجبد السيستم شوية زوز سنتي. So this is the first marker. نجبد السيستم شوية. So anytime we feel some resistance, we have the distal radio opaque marker in the upper part of the common hepatic duct, which maybe is locking there, so we have to pull it back. C'est bon. So, and we see as we pull it back, the stent is going there. So I will continue pushing. This is my second marker. And stop. And I will be able to push more now. And this is my stent. So my stent is fully deployed. So I can put it more inside. So we'll release slowly our stand and our pusher. And we have the two stands, one along the other. So we crossed the structure, the common hepatic bile duct structure. We extracted our stern. Maybe so we'll clean some water. And the stern was cleared out. I don't think we have still stern there. We manage the dilation, the stent insertion. سورانك 20 في الأخرى. عندك سورانك 20 هات حتى عندك، هات اللي مش لازم، هات اللي عندك هذه لي، هات هذيك هات. So what just we have to focus on this little lesion there. So we'll check it again after maybe 3 months. We will watch with some cold water. We didn't touch the pancreatic duct, but we make some dilation of the lower CBD. So I think the patient was lucky because there was a big stone, just little, but a lot of stones. We don't even need any dilation to extract this stone. So we unlock our wheels and go back slowly. We will exfoliate our stomach from CO2 and water. And I think we will discharge this afternoon as we didn't have any adverse event, no bleeding, no, I don't think there is any perforation. We didn't dilate a lot. So the next step will be the 1 month blood test to see if we have less abnormal liver tests, and maybe after 3 months extraction of the stent and negotiate which next step. Maybe we'll put another 3 stent more, or maybe leave it just like this.